Here with Karen, we're going to be doing a permanent bridge on her. She's got a missing tooth on the lower right. So we're going to go ahead and cap the 2 teeth adjacent to the space. We'd already numbed her up for this. Here there was some decay on the tooth, so we had to add a material to build back some of the tooth that I removed that had decay in it. Sometimes you need to do that. I'm putting a material called Fuji 9 in there right now. Keeping the area isolated with cotton rolls while I'm working. My assistant Marina is suctioning for me. Just trimming the teeth down. After the teeth are prepared, you need to make a temporary bridge. My assistant is doing that now. She's mixing up the acrylic. A bridge is basically 3 caps or crowns, a 3-unit bridge that is. If you're replacing 1 tooth, typically you'll have 2 teeth adjacent to the space that are trimmed down. And the bridge is basically 3 caps or 3 crowns that are joined together with a dummy tooth in the middle. And the fake tooth or the dummy tooth is anchored to the adjacent teeth. So after the teeth are prepared, what we need to do is we need to go ahead and make a temporary bridge, which is going to be an acrylic version of what the permanent bridge is going to look like. So that's what Marina is doing right now. Just going to trim the excess off right now. Still making the temporary bridge. I'm helping out to trim the temporary bridge right now. Making sure that the bite is okay. Having her bite, we're adjusting it. Now we're taking impression of her teeth, so the laboratory technician understands how to make the permanent bridge. You need to have an accurate impression. We actually took 2 different impressions here, just for accuracy. Now we examine the impression. It looks good. I examine the backup impression. More information that the technician has, the more accurate the final product it will be. So it's critical that the impressions are accurate. Still working on the temporary. Now we'll go ahead and cement the temporary bridge in with temporary cement. Go ahead and cement the temporary bridge in. She'll come back in 2 weeks. We'll take the temporary bridge out, try in the copings, and then ultimately a week after that the permanent bridge will be finalized. She's fine. The permanent bridge has already been cemented in, and it worked out fine.